This week we are going to discuss complementary and alternative medical therapies. I'm drawing from some information that I gained while in Adam Perlman's class at Rutgers University, at the time University of Medicine and Dentistry of New Jersey. Dr. Perlman heads the Institute for Complementary and Alternative Medicine. We'll start with the definition. Complementary and alternative medicine is a group of diverse medical and healthcare practices and products that are not presently considered to be a part of conventional medicine. However, practices once considered alternative have moved, in many cases, to the allopathic or conventional camp, and vice versa. For example, at one time chemotherapy was considered taboo in allopathic community, and now we know it's the mainstay of cancer treatment. Another example, more recent, is E-stim. It's used widely for pain management. Not so many years ago, yeast-free and milk-free diets were used as treatments for fungal infections and stomach ulcers. However, we know that they are not effective. So, therapies in one category or another can fluctuate as they enter the stream of practices. Some additional definitions. Alternative means used in the place of conventional medicine. So a person practicing alternative therapies would not seek traditional Western doctors. Complementary medicine is used alongside conventional medicine. Individuals would employ two or more practitioners. For example, someone who is trained in acupuncture, such as a traditional Chinese doctor, plus an anti-inflammatory agent prescribed by an MD, or maybe the person might even see someone such as a physical therapist to learn how to use E-stim therapy. Integrative medical therapies involve the use of a single practitioner incorporating allopathic and non-allopathic strategies to treat disease. Many of the doctorate of osteopathic programs are trained in integrative medicine. Interest in the healing properties of food has given rise to an industry known as functional foods. Functional foods are foods that have an added ingredient to fulfill a particular function in the body. For example, we've been adding vitamin D to milk for many years because of decreased sun exposure in our society. Cranberry juice may be used to prevent UTI. We're likely to see more of these products, though the science behind them is quite limited. One example of the use of a functional food in clinical practice, as I said, is giving cranberry juice to prevent UTI symptoms. Bifidobacteria derived from yogurt is being given to prevent diarrhea in the ICU. This population is typically on high doses of antibiotics and is more likely to suffer from diarrhea. AREBs are given for macular degeneration. Chondroitin is given for osteoarthritis. So again, more and more functional foods and derivatives of foods are being given to prevent or treat diseases. In one survey, it was noted that 34% of patients had been under the care of one or more quote-unquote cult doctors. 26% of the respondents received treatment through pseudo-medical agencies, and 87% had dabbled in what the Western doctors consider cult medicine. This survey was actually published in 1924. So what's the history of CAM therapy? Prior to the development of anesthesia, allopathic medicine was really cruel. It involved terrible practices including cupping and bloodletting. The father of modern alternative medicine was Dr. Samuel Hahnemann. He disdained those modern medical practices of his day and developed the practice of homeopathy. Incidentally, he's the only MD to date who has a statue in his honor at the Washington Mall. And all early hospitals in the United States offered only CAM treatments. However, because of the limitations of homeopathy and the development of anesthesia and other advances in allopathic medicine, CAM therapy was pushed aside for what we consider more modern allopathic Western medical treatments. In 1847, the American Medical Association was erected to serve as a barrier between orthodox medicine and the irregular alternative medical practices that would have been characteristic of Samuel Hahnemann. Now let's fast forward a little over 100 years. In 1998, the American Medical Association initiated coordinated themes on alternative medicine for each of its 9 journals. And this has come about because of the increased interest in alternative medical therapies. Medical practices have often squared off against each other rather than considered the patient's point of view. Over in Europe, British midwives, many considered sorcerers and witches, treated patients with foxglove, basically modern digitalis, for heart problems instead of the accepted treatments of the day that were far more inhumane. As I said, bloodletting was a common practice in orthodox medicine of the 1700s. It was used to balance the 4 humors of the body. Many diseases were attributed to an imbalance of the 4 humors, and restoring balance through treatments, including bloodletting, using leeches or cutting, or perhaps even consuming certain foods or adopting certain practices, was used to treat disease. George Washington, the first president of our country, actually was treated for his fever by leeches, and he basically bled to death from his treatment. This depicts the 4 humors of the body. For centuries, people believed that the humors impacted personality and disease. The 4 humors were blood, phlegm, yellow bile, and black bile. Imbalances needed to be restored to treat problems. An example is, fever was considered a hot condition that could be treated by removing excess blood and restore cooling to the body, or perhaps feeding certain foods, or placing certain amulets or wrappings on a patient to restore a balance of temperature. Childbirth was considered a cold condition that needed to be reversed by avoiding baths, dressing warmly up to 1 month, and eating certain foods. Today, we still use the term catching a cold. This is a throwback to the centuries of belief in this imbalance of the humors. However, as medical practitioners, you all need to be aware that there's a large movement in many hospitals, particularly in California, to integrate these practices in postpartum mothers and other problems. Food companies are capitalizing on this movement. I know, for instance, a couple of dietitians who work in some Southern California hospitals. They've taken the traditional breakfast off of the menu in many of the OBGYN wards and replaced it with various soups and sauces and brines that are supposedly used to restore heat to women who've given birth to children. There are companies run by registered nurses that will come out to the house for 1 month after a baby's born and help mothers adopt these hot and cold practices. So it is certainly a growing movement, but it's a throwback to practices that have been used for hundreds of years. Here's another modern day comparison. CAM therapies may be seen by patients today as more humane, less intrusive, and certainly less expensive. And expense is certainly a conversation of the day when it comes to health care. In the United States, a serious increase in complementary and alternative medicine began in the early 1970s when President Richard Nixon visited China, a country that had been closed for many years to the West. An aide of President Nixon required an emergency appendectomy while in China. Chinese doctors did not use anesthesia for the surgery. They blocked his pain with acupuncture alone. The reports of this successful surgery got the attention of medical doctors in the United States, and interest in CAM therapy was initiated once again. According to a textbook published by nurse Karen Fontaine, the profession of nursing has advanced beyond the Western biomedical model and is incorporating many healing tools used by Asian, Latino, Native American, African, and European ancestors. The healthcare community is rapidly rediscovering that these ancient principles and practices can have significant therapeutic value. Some see this movement as a return to our roots. Others believe it's a response to runaway healthcare costs, growing dissatisfaction with high-tech medicine, and increasing concern over the adverse effects and misuse of medications. The growth of consumer empowerment also fuels this movement. Patients today want options. Baby boomers are interested in disease prevention and healthcare maintenance. However, our model has been built really on sick care, not health care. Most people only visit their healthcare providers when they're sick. Integrated medicine addresses both health and illness. True healing is really a process of emerging from something old into something new, rather than returning to a prior state of being. Alternative medical therapies embrace this philosophy. Patients today are assuming more responsibility for their health due to increased access to information and fragmented delivery of traditional medical care. Patients will seek out midwives to deliver their babies at home. They ask pharmacists about supplements sold on store shelves. They consult with dietitians to find out if particular diets will help with things like autism or with different types of problems associated with autoimmune diseases. They refer themselves to chiropractors and acupuncturists to avoid surgery or taking medications. Here's an example. Matt has a headache. He's been working at the computer in his home office for several hours. Before he learned about natural healing, he would simply reach for a handy bottle of aspirin, pop 3, and go back to his job. Matt joined a healthcare interest group at his local church. He learned some new approaches from the parish nurse, who explained that aspirin can irritate the stomach lining in some people. With others, it may cause tinnitus. Additionally, the analgesic only treats the symptom by blocking the perception of pain. It often numbs the sufferer of trying to understand the cause of the problem. Matt now knows when he has a headache coming on to close down the computer and go to the couch. He picks up an ice pack on the way from his freezer. He lies on the couch, puts the flannel-wrapped pack in the area of pain, closes his eyes, and listens to music. Within 5 minutes he's asleep, and in 15 more minutes he awakens refreshed and without pain. The throbbing, dilated vessels along his scalp have been constricted. He realizes that the stress was originated from his work He remains there another few minutes, takes a walk, and then comes back to continue his work. There are many other examples that abound in the literature. Yoga has been used to reduce stress and consequently hypertension. Carb-controlled and weight loss diets have been used to wean patients from diabetic medications. Unfortunately, CAM therapies are often considered natural treatments, not subject to copyright like pharmaceutical preparations or practice skills like yoga and acupuncture. Consequently, it's difficult to attract funding and conduct rigorous scientific studies for unregulated products and practices that can be grown in anyone's backyard or greenhouse or adopted by anyone who proclaims himself or herself as a practice of CAM therapy. To help wrap our minds around the different kinds of alternative medical practices that exist, I'd like for us to take a look at this classification system put forth by Dr. Perlman. It certainly doesn't include everything, but it comes pretty close. The first one we'll talk about is homeopathy. Homeopathy uses an infinitesimal dose of natural substances to stimulate a person's own defense or immune system. The idea is to introduce a substance that behaves in the body much like the disease. The body responds by mobilizing the defense systems against the agent and cures the person. Again, this type of therapy was used by Samuel Hahnemann. And the different preparations that are produced by homeopathic practitioners contain such a teeny tiny dose of the agent that it can not usually be detected in the final product. It's likely that any curative impact is due to a placebo effect. So if your patients are involved in homeopathic practices, it probably isn't going to hurt them. Naturopathic medicine dates to the time of Hippocrates. It uses the curative power of nature to help the body heal itself. I'm reading from a text written again by a practicing nurse, Dr. Lynn Keegan. She says that a licensed naturopathic physician attends a 4-year graduate level naturopathic medical school and is educated in all the same basic sciences as a medical doctor, but also studies holistic and non-toxic approaches to therapy with a strong emphasis on disease prevention and wellness optimization. In addition to the standard medical curriculum, the naturopathic physician is required to complete 4 years of training in clinical nutrition, acupuncture, homeopathic medicine, botanical medicine, psychology, and counseling to encourage people to make lifestyle changes in support of their personal health. A naturopathic physician takes rigorous professional board exams so that he or she may be licensed by a state or jurisdiction as a primary care general practice physician. Ayurvedic medicine has been practiced in India for 5,000 years. It attempts to restore balance of the body to nature through diet, herbs, yoga, meditation, detoxification systems, exercise, breathing techniques, and others. Herbal therapies are used by many practitioners as an alternative to drugs. They are broad-based applications. For example, although valerian is known as a sleep aid because we derive Valium from it, it is used to treat any nervous system disorder. Another example is ginger. Although it may treat nausea, it is given by herbalists to treat most any digestive problem from constipation to stomach upset. Chiropractic medicine was established in 1895 and is based on a single premise. That premise is that the spine is the backbone of human health. If the spine can be properly aligned and a proper flow of nerve impulses occur, the body will heal itself. Again, taking from Keegan, osteopathic medicine is a form of medical care founded on the philosophy that all body systems are interrelated and dependent upon each other for good health. This philosophy originated in 1874. A Missouri physician who championed the concept of wellness and established the American School of Osteopathic Medicine. Osteopathic physicians, like their medical counterparts, must pass a national or state medical board exam in order to obtain a license. There are 37,000 osteopathic physicians practicing in the United States. Like medical doctors, osteopathic physicians provide comprehensive medical care, including preventive medicine, diagnosis, surgery, prescription meds, and hospital referrals. In diagnosis and treatment, they pay particular attention to the joints, bones, muscles, and nerves. One aspect of treatment is through manipulation of the body's joints and tissues to restore them to their normal positions and mobility and release tension in muscles and ligaments. They're specially trained in osteopathic manipulative treatments, using their hands to diagnose, treat, and prevent illness. Traditionally, the work of osteopaths focused on the spinal column. However, today most osteopathic physicians practice very much like medical doctors. Though they're often compared to chiropractors, osteopathic physicians go through a training and licensure process similar to that of medical doctors. Up until recent years, it would be difficult to find a DO in this area, but now we have a new medical school in Dothan, and I believe one is soon to open in Auburn that will provide training for this type of healthcare practitioner. This is the first of a series of charts from a 2010 descriptive study on CAM use in the United States. This chart displays the most frequently used CAM therapy that you might encounter in your practice as a nurse. Number 1 is supplements. Many drugs, many of them have nutrient and drug interactions. This is quite alarming since the supplement industry is not regulated. Because of the increasing patient demand for CAM therapies, particularly for diseases that Western medicine offers little in terms of cure, health organizations are adding CAM practices daily to their lineup of treatments. Those treatments often include dietary supplements. Scientific evidence supporting the benefits of some dietary supplements is well established for certain conditions, but others need further study. This is partly due to the way dietary supplements are regulated in the U.S. by the FDA. Research studies in people to prove that a supplement is safe are not required before the supplement is marketed. This is different than what we would see with drugs. For example, several years ago, probably 20 or more years ago, when it was discovered that cancer is often a failure of the body to protect itself from free radical attack, healthcare providers began to suggest to patients who were suffering from cancer or had been treated for cancer that they take high doses of antioxidant vitamins. This was done with no scientific basis. After a couple of years, someone decided to go back and look at the patients who had received these supplements and those who didn't. They found that those taking tablets of these high doses of antioxidant vitamins actually had an increase in cancer recurrence. It's hypothesized that cancer cells are actually protected from destruction by the body from these high doses of antioxidants. So it's an example of the science that is lagging far behind the marketing and advertising. The manufacturer does not have to prove that the supplement is effective. All they have to say on a claim label is that this statement has not been evaluated by the FDA and it's not intended to diagnose, treat, cure, or prevent any disease, even if the label says otherwise. Dietary supplements are not intended to treat, diagnose, mitigate, prevent, or cure disease, and in some cases they may have unwanted effects, especially if taken before surgery or with other dietary supplements or medicines. Getting back to our study, many of the people who use CAM therapy are likely to be more educated. They come to their healthcare practitioner often with more knowledge than the person that they're seeking help from. CAM users may be of any age, but most are middle-aged. The reasons that they give was to prevent disease or to prevent pain. Over half are trying to treat a specific health condition. And another group said that they were trying to supplement conventional medicine. CAM users are not likely to engage their providers in conversation about CAM practices that they're using. That's why it's important to consider this when taking down information from your patients. About 25% might bring the subject up with their doctor, who is very likely to not be trained at all in CAM therapies. There's been little improvement in willingness to talk to healthcare providers about a patient's behavior with regard to CAM therapies in the last 4 years, or between the time that these studies were conducted. When they do engage their healthcare provider, they want to know if what they're doing will hurt them, what therapy to use, and if it's effective or safe. 20% want a referral to a CAM provider. Reasons given for not discussing CAM including failure of the healthcare provider to ask, not enough time to bring it up, didn't think it was important, or other healthcare provider issues. Unfortunately, most CAM users rely on unreliable information to support their use of these alternative therapies. Alarmingly, many CAM users were also on 2 or more medications. Given the poor information resources, reluctance to talk to the healthcare provider, this represents a serious potential problem for a negative adverse event. I personally know a story given to me by a med-surg nurse who was involved in a surgery where a woman had been taken off her Coumadin for the appropriate amount of time to decrease her clotting time, but in surgery she began to bleed profusely, and they had to stop the surgery and get her blood to clot. And the nurse went out and began to speak with family members and learned that this patient was on very high doses of vitamin E. It's very important to question patients extensively about the types of CAM therapies that they're using. You might be wondering, do any CAM therapies actually work? It's hard to know. Most reports are anecdotal. Products and practices are not standardized. For example, a person who says that they are trained to be an acupuncture provider, they may really not be, because there's no standard school, no set learning outcomes for someone who can state that they are a trained acupuncturist. However, there was a 2012 review of 338 studies that found evidence that complementary therapies was cost-effective and safe in several clinical conditions, and there were 7 of them. They found that there was evidence to prove that acupuncture and massage therapy was effective in several cases of pain management, that arginine and omega-3 fatty acids were helpful to improve healing time for gastrointestinal cancer surgery patients. They found that vitamin K is effective to reverse bone loss in postmenopausal women with osteoporosis. There was evidence that vitamin C, E, and beta carotene can slow down development of cataracts. And omega-3 fatty acids are effective for treatment of coronary artery disease. Glucosamine chondroitin sulfate, which you've seen advertised on television, has been proven effective for some cases of osteoarthritis of the knee. And spa therapy has been helpful in fibromyalgia. So what's the bottom line for you as a nurse talking to patients? Most patients will not proactively disclose their use to their physicians. Patients with chronic and acute medical conditions, including cancer, diabetes, back pain, depression, may often turn to complementary healthcare practices in large numbers. They're likely to be well educated, and since they're middle-aged and older, they tend to be able to pay for these services. As more patients use these practices, you'll need a full picture of all conventional and complementary practices they're using so you can effectively manage their care. It will be important to include a question about the use of complementary healthcare practices on medical history forms. Patients will need to bring a list of all these therapies they use, including prescriptions, over-the-counter, herbal therapies, and teas, patches, and other complementary healthcare practices such as yoga and massage therapy. Patients can be referred to credible federal resources to get evidence-based information and patient education materials. We don't have to know everything about complementary healthcare practices. Here are some resources that you could use in your own practice. It's also a good idea to go through the yellow pages and see if there are legitimate sources that you can send patients to. Keep an open but informed mind. There's no one treatment that is effective in every case. Just because something is natural doesn't mean it's safe. And just because something is rejected by the medical community at large doesn't mean that one day it won't be proven effective. Take the time to ask and research the therapy to learn if it's harmful, helpful, or neutral, and then act accordingly in the best interest of your patient.